Good morning and welcome to the Cowlitz County Board of Health meeting. We'll start this meeting at 10:01 today. Thank you for coming. First thing is the minutes. Everybody should have a copy of the minutes there, and I'd entertain a motion to accept the minutes. Someone wants to make one?
I move to accept the minutes.
Motion to accept the minutes from Commissioner Farrell. I was not there. Thank you very much, Rick, for taking over that meeting while I was gone. So all in favor of accepting the minutes from April 29th? Aye.
Aye.
Aye. Any opposed? Okay, unanimous, carries. Okay, first thing up, we have, hopefully, I see Dr. Krager and Gina and Carol with us for HHS quarterly report. Thank you guys for being flexible. I know I went back and forth. We were thinking about a different agenda, but here we are, back on track.
It's all
Anytime.
good.
No
That's right. Public health is all about flexibility.
Flexibility, there we
That's
go.
right.
Thank God.
Yeah, so we have some slides that the clerk can pull up for us. We're just going to go over a few general things, and then we're going to talk a little bit about rabies today. Everybody's favorite or not favorite topic, depending on who you are. And there are copies of the slides up here if the audience wants to see them as well. No, okay. So just a little bit of an update about what we've been up to recently. Go ahead and go to the next slide. Thank you. Our front counter folks have been incredibly busy. Our birth certificate orders are up 65% over this time last year.
Do you know
Um,
why?
We do know why. So the real ID requirements that have come about, folks are hurriedly updating their driver's license so they can travel. So
Okay.
by the end of April last year, we had done about 1,300 birth certificates, and this year we've done over 2,100 as of the same time. So they are hopping. All of our administrative staff do those. We do online orders, in-person orders. Incredibly busy.
So
But
this is being driven by the real ID stuff.
exactly.
Okay. We're
Yeah.
not having that many more babies. born.
Nope.
Okay.
Although we did notice incidentally, nothing to do with that, our death certificate orders are up by about 20% as well. I don't know why, but deaths haven't increased by 20%, but folks are needing that legal documentation for something.
Okay.
They're
So-
getting real IDs too.
Yeah, maybe posthumously.
Voting rights.
Birth certificates, it's a long process to get your birth certificate now. You have to prove your identity in order to do so, so it's pretty laborious. It used to take staff 5 or 10 minutes maybe to process an order. Now it takes anywhere from 15 to 30 minutes, depending on what's given as proof of ID. So those are the state requirements that we have to abide by, and our front office, front counter, that's what they spend a majority of their time doing, is birth certificates and death certificates. So just a little heads up there, kind of interesting when I pulled the numbers. I knew they said they were busy, but when we saw how much, we were like, well, no wonder. When they come in on Monday mornings, there's a pile of online orders, 70 to 80 orders at least every Monday morning waiting for them. So it's quite a bit. Next slide. So our community health team, our public health nurses, they've been incredibly busy as usual. They have always got lots of STDs on their hands. Tuberculosis, I will say that our role in tuberculosis is to make sure folks with active tuberculosis get directly observed therapy. So we get to watch them take their medication once a day. That is the requirement when you have active tuberculosis. We used to have maybe 1 case a year, but we are now at a point and I don't know the data specifically, but we always have at least one case that we're working on, sometimes two or three. So we are seeing more. I don't know the definition of more. We haven't really looked at the data, but tends to be a lot more than they're used to, and it's pretty labor intensive.
Yeah, the data does reflect kind of what we've seen a little bit in the state, especially the last couple of years where we've just been more active tuberculosis, and it is really intensive. Our nurses, yeah, go out to people's homes, watch them take their medications, and that's like the best evidence way that we know to treat tuberculosis. 6 to 9 months of treatment is what, and we're talking like 12 to 20 pills. People don't like taking medication for that long. So once they start to feel better, they often stop. And that can lead to drug resistance, where we get like multi-drug resistant tuberculosis. So that's the reason for that kind of labor intensive practice.
Yeah, so
You said
lots of work. Go ahead.
It's like a 6-month process? Is that what you're? did I
Yeah,
hear that
most
right?
regimens for active tuberculosis are
About a
6
6-month
months. Yeah.
program?
Mhm.
Okay.
And it's a daily, once a day pill?
Yep. Yeah, we start out with 4 different drugs and then usually narrow it down to 2. It's a complicated drug or a complicated disease to treat.
And how many cases was this county working on?
We have 2 active cases right now. Yeah.
And so that'll often involve, like he said, they'll go out to their home to make sure they're taking their medications, check and make sure that, lots of times we'll see folks that have other issues going on with the tuberculosis because they can already be sick. And I think sometimes the way people find they have active tuberculosis and is when something else is going on. And they think they have pneumonia or whatever, and it ends up being that they have tuberculosis for some reason.
I assume we're only talking about respiratory tuberculosis, right?
No, we're not just talking about respiratory tuberculosis, but yes, I-
Atypical also?
you can get, what was that?
Atypical tuberculosis also?
Yeah, you can get tuberculosis in any part of your body. About 35% of tuberculosis is non-respiratory. Yeah, so we see it in different organs. Bone is common. Sometimes we see it in people's eyes. Yeah, we see it in lots of different places. Kidney, intestinal.
How many of them are contagious and for how long?
Yeah, so thankfully only respiratory and like throat tuberculosis is contagious. And it depends on treatment is the main thing. So if you are actively symptomatic, coughing with tuberculosis, you're considered contagious. But once you start medication, it can usually take like 5 to 14 days to not be contagious any longer. But again, we're often catching people. It often takes a while to catch someone, right? They have symptoms, but they don't know what it is. They go to the hospital a couple times. Because tuberculosis is so rare now in the United States, which is great, people don't think about it a lot. So we do often see unfortunate cases, yeah, where they've exposed a number of people. But that is another part of our work is doing that contact tracing and trying to track down who might have been infected, and then we test them. And yeah, that's sometimes how we find other active cases as well.
As far as the protocol to send a nurse to visibly watch somebody, where was that developed?
Oh, that's a great question. What was that? Yes, exactly. So yeah, my understanding is it's been studied especially in like really high burden tuberculosis countries, so other countries around the world. And yeah, I mean, I'm sure it's been studied in the US too, but we've just had better control of it for the last few decades. But even in the 80s and 90s, and countries still do struggle with tuberculosis and making sure people take their medication, which is why a lot of other countries have really high rates. Russia has really high rates of multi-drug resistant TB, which can be very difficult to treat. Sometimes regimens, if you get that, we're talking about 18 months to 2 years sometimes. And tuberculosis, I could talk about tuberculosis forever. It is the #1 cause of death for infectious diseases in the world. So It kills more people than HIV, malaria. It's still a huge problem in lots of other parts of the world.
Once a person's been diagnosed with tuberculosis, that window between they're not contagious and between being diagnosed and no longer contagious, is there a method of
Yeah.
quarantining during that time? So that it's
Yes.
not, okay.
Yeah, that's a great question. That is something we support people in doing is, yeah, making sure they're staying home, not going to work. Depending on people's living situations, sometimes we have to help them like find a hotel room for a certain amount of time. It just depends on everyone's circumstances. Yeah, it's a great question.
Yeah, and I think modern technologies has also helped us. Generally, once the person is stable and we know that they're not contagious and they're on the route to recovery, I guess you could say, we will do what we call video directly observed therapy. So basically, it's a HIPAA-approved application that can be used on a smartphone, and they can record for us a video of themselves taking their medication, or we can, kind of do a FaceTime kind of thing with them so we can see that they're doing their medication. It's a lot less time, obviously, than going out in the field to someone's home. And so that is something that has been a great thing to come around and that we've been using more and more. Depending on the patient, some folks may not have, be technology savvy. So we're careful with that too, but.
Could you?
I was just going to add that the CDC has some great information on tuberculosis, the treatment, the history, prevention, as does the NIH. So it's quick to research it. It's a very interesting disease.
And we could always bring it forward for another meeting to talk more in depth about tuberculosis. Dr. Kreger would probably really love that.
I would.
Just real quick, could you clarify the public health standpoint of taking the time and the resources to actually have to observe somebody to take their medication for that amount of time when they're only contagious for 5 to 14 days?
Yeah, great question. It does come down to that drug resistance is the main thing. So, oh man, there was a case, I want to say in Pierce County a couple years ago where someone was kind of in and out of treatment and they ended up with drug resistant tuberculosis, and it was really hard to get them to continue treatment. The problem is that's becomes a larger public health threat when we're talking about a multi-drug resistant organism. So it's really to prevent that longer term outcome. If you treat someone for like a month with tuberculosis, their rate of that tuberculosis coming back is very high, and that risk of having that drug resistance where it doesn't respond to the normal drugs is also much higher. So then it becomes a different kind of public health threat, if that makes sense.
How do you measure when it's gone, when that threat is gone?
Great question. Tuberculosis is again, could talk about it for a long time, but it's kind of a sneaky bug in that it likes to hide in our cells. So it is not easy to confirm that someone is no longer infected. But a lot of it has just been study. So, we treat a group of people for 4 months, we treat a group of people for 6 months, and then we, watch them, like which group does better over time. And we found, the people who complete that full 6 months, they have less rate of relapse in terms of that disease coming back or not. But we also follow people cough up sputum. That's one way that we track. So if we can see the, we can see the organism in the sputum, that goes away like in a month or two in most people. So it's not a definite cure, but it's a good sign that things are getting better. And then, chest x-rays and symptoms we also follow. And those are another way to kind of check on someone's progression. But again, it's no one way is a way to say you don't have tuberculosis anymore. But if people complete that 6 months, and sometimes it's 9 months, depending on different factors, their rate of relapse is pretty low. We're talking like, 95% usually don't have TB again the rest of their lives. Yeah.
I have a question. So it can be 4 months up to 9 months
Correct.
for the treatment. Are these nurses going out every day for 9 months to these patients?
It depends. Like Carol was mentioning, if we're able to, after someone has kind of gotten used to taking the medications, they're not having side effects, they are handling it well, then we try to transition people to that video platform because that is a lot less labor intensive. Yeah. Some people refuse that, and so we still do the in-person. And then, yeah, some people, don't have family support. They're not comfortable with phones. So those are the other factors that kind of play into things. Yeah.
Other questions?
Great
Like I said, we
questions.
can bring TB back. He could talk for days. I think any health officer, could probably talk for days about TB. And we've seen so much, like so many different age groups,
Right.
so many different types of TB. It's pretty.
Well, let me ask
crazy.
you one more question.
Sure.
Why is taking the pill so people don't want to do it? I mean,
Yeah.
Is it got a bad taste or bad side effect? or
Great
what?
questions. It depends on the person. Some people do fine, but there can be side effects. It can cause just general kind of stomach upset sometimes, especially in the beginning. It can sometimes cause other kind of side effects, joint pains. A lot of it is, yeah, nausea and kind of GI upset. So we do various things. We have people take it with food. We have some people just have to take it at night so they don't feel that nausea. Those are the kind of the main ones. There are rare, like liver side effects that we are always watching for, and sometimes we have to switch people's medications because of that. But that's pretty rare.
And I think lots of times after a month or two, right, most of us, oh, I'm feeling better. Why should I finish my antibiotics? I have family members that are like that, they never finish a bottle of antibiotics ever because they feel better after a couple of weeks, which that's, I think with TB, what happens.
Yes, absolutely.
Thank you.
So the other piece that our nurses have been working on, which is less easy to pinpoint, is chicken pox. And I don't know.
You want me to talk about it?
Just briefly.
Thankfully, our public health nurses, one of the things they do is any sort of infectious disease outbreak they may, and we're not having a chickenpox outbreak, but there's been a couple of potential clusters that we've been tracking and keeping a close eye on. So not much to say about that right now, but just to keep it on people's radar. Should we talk about rabies?
I had just have a
Oh,
question on the
yeah.
chickenpox. Because I know you monitor outbreaks,
Sure.
et cetera. Do you do the same with shingles?
No. Great question. Yeah, shingles is less transmissible, thankfully. It's the same virus, but a lot less contagious. Yeah.
And then the other section, I think, in Health and Human Services is our environmental health folks. They've been really busy. If you'll remember, a couple months back, we talked a little bit about food safety and what our restaurant inspectors do. And we know last year, we were very short-staffed. We were down half staff. And so we didn't get to do all the inspections that we normally would and that we're required to do. And so we are super excited to say that as of the end of April, we have done 600 food inspections in the county. So everywhere that you eat has been inspected at least once this year already. We're trying a different method kind of scheduling our food inspections, and it worked really well this year. So, and a reminder that those inspections, if you ever wanted to see how your favorite restaurant is doing, they're available on our website. So folks can always look at those. But they've been super busy with that. And then now they're transitioning into inspecting public pools and spas. So hotel pools, apartment complex pools and spas, the YMCA, Gaither Pool, school, pools that are inside of schools. So they inspect those this time of the year. And actually, I think schools might be the wrong one. We probably do it different cycle because of the school year. But it's all the other ones that are going to open up for the season. We inspect those. So they're busy working on that. And then along with that, temporary events and permits. Our food safety staff go to all those events you see around town. They're at Squatch Fest, they're at Go Forth, they're at all the fairs and the rodeos and the farmers markets and all those things, inspecting those vendors. So again, all of those vendors are licensed by us. We want the food to be safe for folks to eat, so that's what we get to do for the next 3 or 4 months. Staff are hopping on the weekends, and it's good times, but they'll be there. You'll see them around probably at the beginning of any event, really inspecting those places, so.
Like food trucks that come in here for events
mhm.
get inspected?
Yes, yes, and Gina may know a little bit more about that, but if someone's licensed in another county, we do like a reciprocity situation where we honor another county's annual permit for certain types of food vendors, so.
Okay.
But yep, those should all be inspected. This time of the year also, our environmental folks staff are out inspecting campgrounds. So all the local campgrounds, KOAs, whatever they are, they're out inspecting those to ensure, proper trash cans, sewage disposal, all those things are happening in those RV park campground places. So, and then, of course, solid waste enforcement. Every day we do solid waste enforcement, but I would guess it probably kicks up a little bit during the summer, spring, early fall. We are charged with enforcing folks that do illegal dumping or have an overgrown amount of trash that's attracting bad vectors into folks' yards and things like that. So we actually like to bring that back maybe to our next update and talk a little bit about some of those stories and what those look like and some of the successes we've had recently with folks cleaning up those messes that get reported to us.
Carol,
Yeah.
are we seeing on campgrounds and, sewage disposal, black water, gray water, and solid waste, are we seeing an uptick throughout the county in having issues with those?
Not particularly, not of the ones that are licensed campgrounds by us. I won't talk about, this is completely separate from, perhaps illegal camping and things like that, but the ones that are, that we go out annually and inspect. I think last year, some of you folks, well, maybe only a couple of you were on the board when we approved the new campground ordinance last year, the county code. So that talks about an annual inspection that we do on campgrounds in the county.
Is that not the approved campgrounds too?
This is approved campgrounds
Is there-
that we're talking about.
Are there any inspections going on to these campgrounds that are not approved?
There are not, and we could probably have a different conversation about that, but
Just curious.
really only working with the folks that bring folks in that pay for a campsite. It's a business, that type of thing.
Hmm.
Yeah, that's what we regulate currently. So we can bring back that solid waste conversation maybe next time around talk a little bit about those stories. So really what we really want to talk about today is rabies. So we do have a zoonotics or vector program, so we really concentrate on rabies. And really our goal of the program is preventing diseases from being passed from animals to humans. Generally, we're talking about bats. It can be other things. In the past, we've had otters. Believe it or not, someone got bit by an otter several years ago, so that, there is a possibility of diseases being passed that way. But generally speaking, when we talk about this, we're talking about rabies. So next slide, Dr. Krager is going to take it over for a little bit.
So you've probably heard of rabies, but it is a virus. It very quickly infects your nervous system if you are infected with it, and eventually your spinal cord and your brain. It does lead to death, and it's essentially almost always leads to death. So there's only been 1 or 2 known cases of people surviving rabies after symptoms develop. So the good news is that we can prevent progression of that disease and prevent deaths with rabies vaccine and what's called immunoglobulin. It's still a big problem worldwide, especially with dog bites. 59,000 deaths worldwide. In the United States, we're pretty lucky. Only 1 to 3 deaths of rabies in the entire country, which is honestly pretty amazing. Used to be hundreds of deaths prior to the 1960s. So if we have pets, we probably have all, gotten our cats or dogs rabies vaccinations. That's probably maybe the biggest reason why we've been able to reduce that so much. But like I mentioned, if you contract rabies and start developing symptoms, things are not good. You have a poor chance of survival. Let's go to the next slide. So rabies spreads when an infected animal bites or scratches a human or another animal. So that's and like Carol mentioned, bats are our biggest vector, our biggest reason, our biggest place where rabies comes from. Bites are the highest risk because we're talking about, you know, saliva from a bite often having a large amount of rabies virus in it, and then, you know, depending on how deep it goes, that can, you know, a deep bite can get pretty far into your system. That just leads to greater risk of infection. There is a smaller risk of just getting like saliva in your eye or your mouth or another wound. People have been infected with rabies by that, in that method, but it's pretty rare. But we still take that very seriously if that happens. We do the state tests for rabies pretty often in various animals, mostly bats. And right now, bat is really the only known carrier of rabies in Washington State. We do worry, you know, especially if like a dog or some other wild animal maybe is coming from another place, or if an animal is acting rabid, which is not easy to define, but we will still often treat it, you know, especially if we're not able to test the animal, we still may treat it as a rabies exposure. One of the biggest things with bats, they have tiny teeth. And sometimes people are bitten and you don't realize it. And I will point out this can happen at night while people are sleeping. So that's the danger of, you know, waking up, finding a bat in your bedroom. You may look over your entire body and think, yeah, I didn't get bit. But honestly, we still treat that as an exposure. And one of the few cases in Washington in the last, I think it was about 30 years ago, happened in a child, and that child died. They did not realize they were bit by a bat. I think that was in the 90s. Let's go to the next slide. Oh, last, just looking at kind of where we found bats across the state. Again, any bat that that exposes someone, we're going to be worried potentially has. Oh, can we do the next slide? Sorry. Thank you. I just thought this was kind of interesting. We still do find bats, or we do find bats with rabies, and this is where we saw them last year. So, and again, we can kind of see that bat season in kind of the summertime, so June, July, August, September. That's when bats are most active. That's when we get the most reports, and that's where, you know, the number of bats getting tested goes up in that graph on the bottom. Okay, let's go to the next slide. Let's see. I'm doing this, right? Okay. Yeah. Part of this is often a combination of with our environmental team as well as our public health nurses trying to understand the risk of rabies from an exposure. Sometimes we end up, an animal is euthanized and we send that animal to the public health lab for testing. It can be, we want people to be cautious, obviously, if there's a bat that bit them, but if you're able to catch it without any further danger, sometimes that can be really helpful, because then we can test it. If we can test it fast enough, sometimes we can prevent you from having to get a bunch of very painful rabies shots. And that we can do that with other animals as well, but again, it depends on how that animal is acting, whether that bite was provoked, that sort of thing. Dogs are, again, we haven't had a dog test positive for rabies in Washington State for a long time. So we don't investigate every report of dog bites. But if there is, again, a dog acting rabid, we would investigate. We would investigate that and consider, with dogs and other pets, sometimes we can just quarantine the animal and watch it. Sometimes euthanasia is recommended depending on how sick they are. It really depends on the case. And then, yeah, we don't send every animal. It's really just if there is a risk to humans that we see, and certain domestic animals, if we might, that animal might be a clear risk to another person.
And one of the reasons we don't test every animal for rabies is because the only way to test them is by testing their brain. And so they have to be deceased to do that. So we don't just, obviously, for obvious reasons, we don't go around doing that.
Yeah, one of the, things I talk about with our nurses is, you know, you need, especially with a bat, you need like an intact specimen. And sometimes when you kill a bat, people will be violent with it. And then it's harder to test, honestly, the brain if it's all smashed. So it's a little bit into the weeds, but that's just the truth of the matter. If you're able to get, and and we're able to sometimes take a bat to like a veterinarian who will euthanize a bat if it's still alive. So that's a safe way to do it if you're able to, you know, contain it in a very clear enclosed container. All right, next slide. Okay.
So yeah, we probably receive at least 50 or more inquiries a year from folks curious about whether they were exposed to rabies. They think, you know, they saw a bat. What's the definition of that? It's a pretty intensive interview process that our nurses go through, talking with someone to determine if they were exposed. You know, like Dr. Krieger mentioned, someone sleeping and they don't know they've been bit. So if you wake up with a bat in your bedroom, that's a big deal because you don't know if you were bit or scratched or anything like that. So we work through that with folks when they call. And you'll see here, we average about 3 or so bats a year that we test. We send them off to the state public health lab for that. And we haven't had any test positive since 2019, but in 2019, we did have 2 bats test positive for rabies in our county. So that was actually someone had, oh gosh, we Googled this the other day. What is a colony, right? They had a colony of bats. I believe it was in their carport. And a couple of them did test positive for rabies. So, and they had pets and kids and, you know, it's a big deal. You want to make sure your family's safe.
So these numbers are only Cowlitz County?
Correct. These are only Cowlitz County.
And when you test those bats, are those randomly tested or something happened and we go in and test?
Something happened and then we would work with whoever has the bat to figure out what to do next.
Is it just naturally occurring in bats or how do they contract it?
Yeah, that's a great question. And I'm gonna have to, I might have to get back to you, but yes, there is, it is kind of in what's called endemic. So it's just naturally occurring in bats. It's kind of passed from bat to bat and it doesn't often kill bats, which is why they can live with it. Yeah, a good question.
Why is it? I guess what determines the number of bats that are infected, I get, since the numbers are so low or seem to be
Right.
so low, it's like,
Yeah, I mean, if you look at overall testing, only about 1 to 2% of bats that are tested end up testing positive across the state. And yeah, it's a good question. I'm not sure like why it's not further, you know, spread among bats, but that's about the number that we see. Yeah. Does that make sense?
And then just some public education here, what to do if you've come in contact with a bat. Wash the bite, scratch, or any contact area that may have come in contact with the bat with soap and water for at least 10 minutes. Reach out to your healthcare provider. That's really key. Or us, we can guide folks. But if you know, they go through the process and we decide there may have been an exposure, then we'll send you to your primary care, your healthcare provider, or the emergency department to get treatment because the sooner, the better. And the treatment's pretty crazy. I think I've heard where like they'll find the location of the bite and you get injections all around that site. So it's not just one little shot, it's a bunch all around the area. No thanks.
Yeah, I've heard it's quite painful. I've never had to
Yeah.
experience it myself, thankfully.
Yeah. So we really emphasize to folks, you know, if you think your pet was exposed to rabies, get a hold of your veterinarian, make sure your animals are up to date on their rabies vaccines. Don't handle a bat with your bare hands. The whole thing terrifies me personally, but call us if you think, you know, something occurred. We're happy to talk through things with folks. And I did bring some lovely handouts up here. So one's like a poster about, you know, reminding kids, don't touch bats with your hands. And another one is just some fact sheet. If you go to the next, actually, we're going to zoom ahead to not the next slide, but the visit our website slide, which should be next. Folks can go to our website. We've got lots of resources there, including how to capture a bat properly and carefully so you don't expose yourself yet again to a bat if it's still alive. Lots of information there about what to do, what to look for, and how to go about it. But it's really our role, is to just make sure folks weren't exposed, lots of public education. And I'm glad we don't see it every day, but there is a certain seasonal aspect to it. It starts about May, and we're going to see lots of phone calls between May and September, October. Folks are outside camping, or, you're out later because it's daylight, and then it gets dark, and here come the bats, and bats. Knowing what I know now, bats just make me shudder, and it's a terrible reaction to bats, but the previous slide that I skipped over just tells you that most bats don't actually have rabies, right? Like, that's the gist of it, but you got to be careful and just be vigilant, so.
And I noted your slide also says we need bats too.
Yeah, they have an important role in the ecosystem, just like anything else. So don't just go around killing bats to kill bats, but if you were exposed, please try to catch that thing. So
So is there any risk if you're exposed to bat droppings from a bat with rabies?
No. Yeah, it really needs to be a bite or a scratch.
Okay.
Is it transferred through its blood? Like if you dispose of a bat the way you were talking about earlier?
Yeah. Yes, if that like blood enters like an open wound that you have, or your mouth or your eyes, that is a potential for exposure. Yeah.
Line up for shots.
Thank you for that.
Yeah.
That was very interesting.
that's, yeah.
Sure. She got a question on maybe some rabies?
Well, yeah, this will be quick because I know you have a schedule here. If you're sleeping, why, it always seems like bats are interested in sleeping people. Is that just because they get into a bedroom, or is there something we can do to repel them while we're?
Yeah,
sleeping?
no, it's a good question. I'm not sure if they're drawn to sleeping people. I think sometimes bats just get trapped, right? They don't really necessarily want to be inside your house. But it is a good idea to make sure they don't have places to enter, right? So it's kind of similar to other rodent proofing, anything you can do to kind of patch up holes, screens on your windows, that sort of thing. Yeah, they're pretty small. That's part of the problem, right? Is they can kind of crawl through different areas. So, yeah, there's not, those are kind of the main steps you can take.
Well, do they smell the blood in you and they come to you from up high while
Good
you're sleeping? I
question.
mean, what draws them to everybody sleeping?
Yeah, I mean, they do, depending on their diet and the type of bat, they may be, attracted to
Bloodsucker.
biting you, but yeah,
Okay. So,
yeah.
and then I had a question about measles. I know it's a little off the subject, but I've been following the measles epidemic throughout the U.S., Texas being one of the worst, but I see Washington State has increased
Yes.
some of their measles outbreak. I don't know if it was called an outbreak. Is it the population that's coming up that hasn't been tested, the immigration of illegal aliens, whatever you want to call them? I see that no one ever speaks about that because they always say, oh, we have this outbreak, but they don't say why, if it's an immunization rate of school-age children that aren't being immunized, or is it the population of the people coming through the border that aren't being evaluated and medicated like they normally would? No one has ever talked about it. That was just my other question.
Yeah, I can speak to that for a minute. I will say the cases we've had in Washington have been, they've all been associated with international travel, but usually just someone like going on a vacation. If regardless of kind of where someone comes from, we would, if someone has measles symptoms, we would test them. And I think that's true of pretty much anyone. And then obviously we have, Texas and Oklahoma having their own kind of measles outbreak, which thankfully seems to be slowing down, I will say. I've been, watching that closely as well. So it's unclear. We've been watching for that very closely. We've had a couple cases where, someone wants to test someone, they're not sure. We haven't had any positives, obviously, here in Cowlitz County. But I think, the ones in King and Snohomish, they've all been, I think there was one transmission from one of those travel-related cases, but there hasn't been any local transmission of measles,
What is the protocol when somebody is testing positive for it?
Yeah, measles is interesting. It's similar where we'd, isolate someone, we'd ask them to stay home. it's not a very long contagious period, thankfully. But what else would we do? We'd obviously do contact tracing. It's very contagious. So we'd want to know, people who either didn't have measles in the past or don't have evidence of immunity. We'd watch those people closely. Yeah.
What type of medication is given, or if any?
Yeah, it depends on the severity of measles. There's kind of a couple different protocols for people. Most people, depending on their underlying health conditions, can do well with, just rest and water and that sort of thing. If we want to talk more about measles, I'm not a measles treatment expert, but I like preventing measles. But yeah, most people recover without any specific medication. Yeah. Supportive treatment is what we call it.
Any other questions from the board?
Just one point of note, bats are nocturnal. And so that's a lot of times why you find them in a bedroom because, and that's, you're sleeping and they're active.
That's a
So
really
that's
good
just another
point.
point
Thank you.
with bats.
And we do have some information on our website about how to bat-proof your home. So just like, it's like Dr. Krager said, just like with you would with other rodents, so to speak, finding the ways they get in and eliminating those ways in.
Thank you very much for that presentation. Very good.
Thank you.
You want to move on to the next one? You ready?
Gina's got the next one.
Okay, Gina's got the next one. Talk about the state and federal funding. We know there's been talks about cuts here and there and want to see if they've hurt.
Yes, Gina James, Health and Human Services. So on the state front, I know the state budget was just passed last week. There is some reductions for the next biennium to the foundational public health services funding. So this is that about 1.4 million that we've seen the last couple of years in Cowlitz County. We've ended up giving a large portion of that funding back to the state at the end of the year. So we've not utilized all of that. There will be a reduction to that. We just don't know yet what that will look like. So they're sort of sorting through that now at the state level. But we do anticipate a small reduction to that funding for our next contract period. We'll know more in the next few weeks to a month or so. On the federal level, and I think this was part of a question we got from the public, we don't get a lot of federal funding here for our department. And just as a point of clarification, we've heard a lot about funding cuts in the federal HHS. Federal HHS, there's not a direct tie to local. We just happen to have the same name, Health and Human Services. So I just want to make sure to clarify there's not a direct link or tie because we're also called HHS. We've not seen any impacts from those federal level cuts. As I mentioned, we don't get a lot of federal funding. We have heard from other local health jurisdictions who were still accessing certain federal funding that they've seen reductions come and they've seen impacts now with that funding. But some of that funding that other local health jurisdictions were still engaging with is not funding that we're getting or receiving. So we've not seen any impacts in that sense. So
That sounds
that's pretty
good.
much it. Yeah.
That's good.
On that state funding contract, Gina, when is it up? When does that expire?
It expires June 30th. The funding expires June 30th. So what we typically see is an amendment come to us sometime this summer, July or August or so, with that FPHS funding in it. We'll know before that comes what it will look like, but that's when we'll see it come back to the board for consideration.
Do you happen to know how much it is right now and how much we have available to us?
Let's see, we're about wrapping this year up. So this last year's allocation was about 1.4 million, and I think we'll be returning about 700,000 to the state. And so we're waiting to learn what our next year allocation will look like. We think it will be a fairly small reduction. The reduction statewide, it's a lot of money when you talk about it. There, the statewide allocation, the biennium budget is about 296 million statewide. The reduction was 44 million per biennium, but it was offset by, there was some spending authorization approved through the ledge session to utilize some funding from I think it was tobacco and vape tax, in addition to the state general fund. So the overall reduction, I think, ended up being about 20 million or so. So that's really big numbers when we talk about how that breaks down with our allocation. I think it'll be a minimal reduction.
Can you just briefly talk to when that money is given to us?
Mhm.
How is it allocated and who chooses, what's the process of choosing where that money goes and what it's spent for?
Yeah, so when we haven't always received that amount of funding. So this was fairly new in the last four years or so. So when it initially came to us, we looked at certain needs that we were seeing in the community and with our department, and had conversations with the board at that time about how we could utilize some of that. So there were some things approved during those conversations to utilize some of the funding, and that's what we spend currently. We also look at certain things, like it was that funding that has supported the school gardens this year. So that's that funding. So it happens through conversations with the board. If we see a need, or if there's something brought to our attention or something like that, then we'll have conversations about utilizing that funding for that.
And when do we do the budget? Your budget is 2 years, is that correct?
Mhm.
And when does that come up again?
So the budget process typically starts summertime. So we'll be starting some of that work this summer. It goes into the fall with the Board of County Commissioners, and we start going through that process. And then I think the board likes to get the budget approved December for the next 2 years. So
Okay, so this year, this winter.
yeah.
Okay, thank you.
Yep.
Any other questions or anything on the budget? Okay, thank you very much, Gina. Okay, moving on to the next topic, water fluoridation, putting fluoride into the water system. I'm not sure, I was not at the Longview City Council meeting, but they did they had a discussion on it, so I'm a little ignorant on that part. I don't know what they decided. I believe that they decided to keep putting the fluoride in the water. Recently, Florida has just banned fluoridation in water systems. They're along with Utah, and there's many, if not most, European countries are not putting fluoride in the water anymore. I'm not sure. I'd like to see, maybe Dr. Krager can kind of help us. What are the concerns? Because I don't know exactly what the concerns are, except that, well, I've heard concerns that adding the fluoride to the water is not just fluoride. There are other chemicals involved. Or is it just pure fluoride? Can you tell us how the system works a little bit?
I wasn't super prepared to talk about this, but I can talk about it a little bit. I will say, we don't have our county doesn't have authority over like the large public water systems like the city of Longview. They kind of make their own decisions about whether to add fluoride or not. So I'm not aware of other chemicals that are being added. Fluoride is interesting. It's a naturally occurring element. The reason we kind of discovered fluoride as a potential public health benefit was because some water systems, I believe they were in Colorado, naturally had higher levels of fluoride, and we studies were done and noticed that the children and people in general had less cavities in those communities. which is kind of what led to the practice. There's been there was a report, I want to say last year, that came out that did raise some questions about, potential neurologic impacts of fluoride. I will note that report was, they were looking at studies in other countries, and specifically they were looking at levels of fluoride beyond what we recommend, or what, is currently recommended in the United States. And that's when, potential impacts on IQ were noted in some studies. So that's where that concern has come from. I do know that there is a state, I'm not a part of it, but there is a state kind of working group also kind of examining the issue and deciding, locally in Washington State, do we want to change our recommendations or not? I would, there are, people, I do know, community dentists and community pediatricians did come and speak at the city of Longview, and I think, inviting experts in dentistry would be a great opportunity if you wanted to talk about it more. But that's my basic overview. I can try to answer more specific questions.
I noticed that the State Board of Health on June 4th is going to be doing a presentation or discussion on that. Is there a way I can ask you or somebody in HHS to kind of keep an eye on what they say
Absolutely.
and report back to us?
Yeah, absolutely.
See what they say. I just wonder, why they're banning it now.
Right.
To me, it's a little concerning. And Karen, please.
Yeah, so I was the one that kind of said, hey, let's look at this. And the reason I did is because it came across some of my medical feeds about the EPA. This was April 7th of this year, and it says EPA will expeditiously review new science on fluoride in drinking water. So the EPA is looking at this as well. So I just thought it's good for us to bring it to our awareness and think about what is going on, what are the new studies with the fluoride in the drinking water. And that is available on the EPA.gov website, and they'll have the whole article. So I just thought it would be good to have the discussion again and see what is going on nationally as well as locally. Thank you.
Yeah.
Kelly, one other note, well, a couple of things actually. So Longview, they actually kept their fluoride in because of a contract they have with Beacon Hill Water District. So they were, I don't know where the council themselves would have landed, but they had a contract with Beacon Hill Waters. So, and Beacon Hill wanted to keep it in, so Longview needed to keep it in. Along those same lines about the EPA, I have here the MAHA report that RFK just came out with this last week, and he actually addresses that as well. And they are also going to begin looking at the interactions between different exposures, fluoride, as well as other environmental chemicals and how that's impacting kids specifically. So I would encourage everybody to read the report that he came out with, as well as just keep an eye on, they tend to work sort of at breakneck speeds. So I would assume sometime fairly soon, maybe 6 to 8 months, they might have more information on fluoride, as well as fluoride exposure and interactions with other environmental chemicals.
Could you send that report to the clerk so she can distribute it out? Do you have access?
Yeah, I'll find the link. It's like a 60-page report, but honestly, it's a pretty quick read because a lot of it is their references, but I'll find a link and send it to you.
I think that would be good for all of us to kind of
Yeah, it
read
was
up on
really
it.
interesting. It was very interesting, yeah.
My personal thought on that was that a long time ago, people didn't have fluoride in toothpaste or anything, and cavities were pretty bad. Let's call it 100 years ago. 100 years ago, so somebody came up, said if it was based on the natural fluoride in the water, I think that was probably a good idea. But now I wonder, since that fluoride is in virtually every toothpaste, it's a household item now, I think. I wonder if we need to be adding it to the water anymore, where I think that maybe it was a good idea at the beginning. But if we can look and see if it's causing any problems, well, that would be something that we should be concerned about.
Yeah. Just so you're aware, the water systems of the county operates are very limited and the county puts no fluoride in its water. As Dr. Craig said, we don't control what the cities do, but as far as the county does, we don't put any in the water.
But is the county water separate from when you say county water, what does that mean?
Well, that'd be like community of Riderwood or some small areas that we've inherited their water. We don't put anything in that water.
Okay, so the county isn't putting anything, but the city, so it depends on the jurisdiction, who's putting it in.
Yeah.
Interesting.
I think that the issue with the toothpaste is you can't force kids to brush their teeth, but they have to drink water.
And I would just also note that fluoride is not just for teeth. It also is involved in our bone mineralization. So, you know, we do need it. It's a matter of how much do we need? And that's the question.
That's a good question. How much? Please.
All right, so I didn't really come to talk about fluoride, but I happen to have a couple decades of studying and using vitamins and minerals. And I can just tell you that depending on where the fluoride comes from, what kind, I don't want to get too detailed here, but the fact is that if it's not the right kind of fluoride, the right kind of mineral, if it doesn't come from a certain place, you can't absorb it. It doesn't do anything for you. Then you might get trapped in your liver or do some detrimental if it's not the right kind. If it's the correct kind, it will do you well. I mean, you could be okay by it, but you also have to understand your own body chemistry. It is how much of this stuff is going to be available to you as an individual. And, you know, I'm trying to stay out of the deep weeds here, but for a fact, if it's the wrong kind, and I could never find out from the Longview Council people, I asked over and over, where's this fluoride coming from? You know, is there a mountain of fluoride somewhere they're digging this stuff out of and putting it into the water? Has anybody checked this bioavailability of that mineral? Along with several others, you need several minerals on a daily basis. You know, gotta have essential fatty acids. You know, these things are daily things. You gotta have a little bit of vitamin C every day. But the fact is that who's drinking enough Longview water to actually make a difference of that kind of difference? Even if you had all the minerals in there and they're the perfect minerals, the water's so bad, who's drinking that in that amount of any kind of amount that would do you any good at all? I mean, the product in the first place is terrible. And then you've got, then whatever you add to it is pointless. That's my point. And fact is, if it's not the right kind of fluoride, it's an absolute waste of time. But I can never find out where are they getting this from? You know, where's this fluoride coming? Chemical company. Yeah, it's not.
I just kind of find it a little concerning that the Longview decided to keep the fluoride in the water, not based on anything about health, but because they had a financial contract they had to fulfill. That's interesting. Hello.
Hi, my name is Kate Clinch, and I just wanted to make a point of that. I've done a whole lot of studying on it. So you're absolutely correct. Fluoride does occur in nature. However, almost entirely all cities, communities do not use the natural form. It's quite scarce, actually. As he mentioned, it's great in Colorado, but we don't have it laying around. So what they use is a form. There's 3 forms. You can look it up, and I've done the research, and I found out which one you can find out which one Longview uses. And Longview uses a form which it is not natural. It comes from the recovery out of industrial waste. The formula is a completely different. It somehow fits the definition of, but it is not natural fluoride. Now, I have not checked to see what Kelso uses. I only know that Longview does not. I live in Longview, so I didn't check Kelso. So just an FYI, it does occur in nature, but that's not what they use.
Are you concerned with it? Are you concerned about it, having lived in Longview and done some research?
I
on
was
it?
born here, yes. So I do have some comments. I was going to wait until the comment period. or I can tell you
No,
now.
please.
Okay. Okay, I'm sorry. I get nervous because I'm actually a person who stays home and tries not to be a pain in the behind.
Oh, you're very welcome. And it's perfect timing to talk about it.
Okay, but first of all, I prepared it because when I get nervous, I can't remember my own middle name. So sorry, I'm going to read it. So first of all, I really do want to thank you for your service to our community. And I also want to thank you for the opportunity to voice my concern. So water fluoridation first of all, water fluoridation is a medical treatment. The FDA has recognized that water fluoridation is a medical treatment for disease known as dental decay. 2, water fluoridation is implemented by local governments. And respectfully speaking, commissioners are not doctors and should not be prescribing treatment. 3, there is no ability to opt out. Citizens are not adequately informed about the potential risks of fluoride, nor given the opportunity to either consent or opt out. And 4, there's lack of dosage control, which this gentleman mentioned. Unlike prescribed medications where the dosage is prescribed, fluoridation in drinking water provides no ability to control the dosage. A glass of water, so it leaves the individual exposed to varying levels of fluoride. I drink a glass of water and I weigh X pounds and it acts one way. My husband, who a whole lot bigger, drinks a glass, it has less impact. A small child drinks a glass of water, it has more impact. So, and one big one to me is the lack of informed consent. An individual must be given enough information to make a decision whether to accept or decline a medical intervention without threat of consequences. So in conclusion, the point that I really, really want to stress is that water should hydrate, not medicate. And bless you and thank you. Those are my 2 cents.
Thank you. Thank you for that. On that point, I'd like to say too, I thought about something last night that this Board of Health passed a medical freedom resolution a couple of years ago. In a nutshell, it says no government entity can put anything into your body or on your body without informed consent. If fluoride is indeed a medical treatment, as this last speaker said, does the water supplier in Kelso and Longview, are they informing the people of what the chemicals are and what the possible side effects are? And well, we probably know it's given, nobody's giving consent for it. But it's something that we should talk about. And Karen, since you brought the idea up, with Dr. Krager going to look into what the state has to say about it and this new information, a little bit on it, I'd like to carry this over to another meeting if the board agrees that this is something we should continue talking about. Anybody opposed? How's that?
I'm just curious what we're looking for as an outcome because I don't have the ability to tell the cities what to do. So I don't know what the outcome I'm all for people being consenting and being informed, but I can't force Longview to change. I can't force Kelso to change. The county doesn't do it. So I don't know I'd have to be clear what outcome you're looking for. If it just want an acknowledgement for us, I think that's fine, but I don't want to beat it to death when I can't do anything about it.
So that's an excellent point, and I agree with you. My objective to bring it up on the agenda is because I think it is a public health issue that's out there, just to bring it up for awareness. I don't expect us to make a decision on it. I don't expect us, because we have no jurisdiction over Longview or Kelso. But I think the fact of letting you know we're watching it and we're aware.
May
Uh,
I speak? Or
Yeah, well,
Well-
just one clarification though, to Rick and Karen. Yeah, I don't know that we control, we don't have any say to the city of Longview directly, don't put such and such in anything, but the RCW of our state says the powers and duties of our local Board of Health is to have supervision over all matters pertaining to the preservation of the life and health of the people within our jurisdiction. So
Yeah. I'm,
kind of overlapping maybe, but
Could,
I would think it's.
wow. You're
But-
asking me to be nanny over other people, and I fight so hard to keep us from being nannies over you that I struggle with that. I'm not going to get into that business.
well, I just want to say, this would be where our health officer could be of authority, and it would take the burden off of the commissioners if he maybe even just put out a statement about what people have questions about and reassure them that it's all safe, or that it's not, or that it could be, or maybe. But at least it would not be something you have to make a statement about. Why don't we let the health department do it? That was just my thought.
Well, I think I got no objection to talking about it, as long as we recognize we're not gonna try and dictate what people are gonna do about it. Being informed is one thing, and informed consent is an individual's right. But I don't want to see us trying to make a decision that says this is what you do or don't have to do. And as long as we don't have it in our system, it's just gonna be an education that we go through.
Well, I think we need some more information then on it.
Yeah, I'm curious, where this state work group kind of lands, and, we can evaluate that ourselves as well and look at it. Science is complicated, and this is a kind of a public health intervention that affects a lot of people. Studying it is hard, so it might be a nuanced conversation to go over those results.
And if, correct me if I'm wrong, Dr. Krager, but I think, didn't Florida, one of the reasons why Florida banned it outright has to do with autism. Is that correct?
I'm not aware of that.
And then, let me take that back up.
Okay.
That's what I thought I read.
Well, I got a question as to the authority of the board here, or the health department itself. Is the health department, if I got a restaurant over in Longview and I'm putting something in the food that's making people sick or not working or whatever, Board of Health's gonna be on top of them, right? So wouldn't this come under the purview of the Board of Health? It seems to me it would. This is something that everybody is exposed to. I mean, this disconnect here between the county commissioners versus the health board is where I'm getting a little lost, because I feel like the HHS they told us to stand 6 feet apart in the store, and we had to do that. And they told us we had to wear a gosh darn mask, and places you had to go to do that. So what's the difference? I
So
don't
you think
see
it's
it.
okay for them to tell us that stuff?
I don't think it's,
Be
I
careful
don't
how
think
much
it's
you
right.
want your government to do for you.
I don't want them to
very,
do
very
anything for
careful.
me, and I'm not drinking any gosh darn Longview water, but I mean, at least from the point of the board, you could come out here and say, here's where these fluoride comes from. That's the answer I couldn't get when Longview was talking about it. Where's it coming from? And what effect is this? What, the word is bioavailable. What bioavailability is there in this material that you're putting into the water? And then you get into the whole thing about informed consent, you know what I mean? I'm not a fan of the department. But I think that, sorry, doctor, I don't mean to be, I think we could actually live without you, but the fact is that you're here, do something about it,
May I suggest that we put fluoride on the agenda, say in 3 months, and Dr. Krager gives us an update on anything that he's run across? How does that sound?
Is that okay with you, Dr. Krager?
Yeah, that's great with me. I can work on that, absolutely.
Yeah.
Okay.
I like that idea too. Okay, thank you for that discussion on the fluoride. Let's keep you up here, Dr. Krager. We had talked about a future meeting to talk about vaccine safety, just in general vaccine safety. And we sent a couple questions to you, and I wanted to see, what do you think, how would you like to do a presentation or talk about that?
Yeah, thank you, Chairman. I think I would, honestly, I'm curious what the board thinks. I'm curious kind of what the public thinks. I'm kind of willing to do whatever you all want. Like I've mentioned in emails, I do enjoy talking about vaccinations. But there's also other things we can talk about too. So if it's a priority and the board wants to move in that direction, and yeah, we put something together, I'm happy to work on that. But I kind of want to ask you all what you all think.
Please.
Okay. Well, I spent some time, just because this was on the agenda, online researching clinical trials for vaccine. There's all kinds of clinical trials for vaccines, except for the COVID vaccine. There is no clinical trials that I can find any reference to. There are right now warnings out from the CDC, from the World Health Organization, from the Food and Drug Administration, are all now advising certain at-risk groups should not get that vaccine or the booster until further research is done. So research hasn't been done. The world got used as a test tube. And now all of a sudden we're advising groups not to take it until further research is done. So I hate COVID. I got to tell you, I hate even bringing up COVID vaccine. But unfortunately, that is what has generated so much problem in trusting doctors and vaccines. Personally, my doctor, ever since this started, has advised me to take the COVID vaccine. I have not taken it. And the reason I didn't take it was because some of the information coming out, I said, please give me the little handout that comes with the vial or with the shot. I want to read what's in it. I was denied that information. And in the past, I've gotten that little folder that's the size of a football field that they fold up to the size of a ping pong ball. That's got 97 languages in it. And I got to find the little English part to try and read and understand what's in there. But when I'm at a point where I got a doctor telling me I should get it, but I can't have I don't have access to what it is, that bothers me. When I see other things like, and I know right now there's all kinds of warnings that ivermectin doesn't work. But I also saw during the COVID period where ivermectin was being used in other countries, and supposedly they had positive effects or outcomes from it. I guess I would ask you, how many people did you subscribe ivermectin for during the COVID?
I didn't treat anyone for COVID during the COVID pandemic. I again worked in public health, and I didn't see patients directly.
Okay.
Yeah.
So my personal, I would like to talk about vaccines because I'm not a scientist. I'm not a doctor. I don't work in the medical field. I'm just an ignorant walking down the street moron that doesn't have a master's degree in medicine or science dealing with vaccines. But the information that I can get, that I do have access to, scares the crap out of me when it comes to where are we at now with just the general attitude of vaccines. I don't know why anybody would trust the CDC, the World Health Organization, the medical community in and of itself. I find myself questioning, how did we get so diverse that we have organizations that are saying, if you administer this drug, you're going to lose your pharmaceutical license, you're going to lose your doctor's license. What happened to the doctor-client or doctor-patient relationship that we could sit down and have those conversations without somebody at risk of penalty of losing their profession? That just bothers the hell out of me.
That's helpful. Can I just real quick? Yeah.
Please.
Yeah. A couple of things. This is, if we do want to kind of talk about this, I would personally, kind of talk about the vaccine system as a whole, right? We can certainly talk about COVID-19 vaccines. It's the recommendations around them are not, to me, not as important as they were, several years ago, but they're but we can still talk about them and kind of what happened with them. We can talk about clinical trials that go on with vaccines. We can talk about studies that happen after vaccines are released, because those do happen quite a bit as well, to study safety. So if that's a conversation we want to have, I'd be happy to kind of summarize what I know.
So, so I would recommend that kind of a vaccine lesson in general might be very helpful. Give a little bit of history,
Sure.
some of the types, because I think that's a big area of confusion
Yeah.
for the general public, is different types, an activated, an inactive, a killed virus versus
Sure.
things. It's like the chickenpox vaccine using a live virus.
Yep.
So I think a little bit of an educational a lesson on the history, the types, and because the mRNA vaccine is so different from some of our others that we know are safe and that have made a huge difference in worldwide public health. Having taken medical mission trips to some developing nations and seeing the devastation that some of the diseases that are there, that we have so well under control because of vaccines, I hate for us to lump them all into the same category. And I think it's really helpful so that we understand the difference. And I'm a vaccine advocate, have been, will be. However, I now am also paying attention to mRNA vaccines and the latest data. So I still very much trust our good old polio and our good old ones that have been around for a long time. But I think that would be helpful as a good discussion on vaccines. Not all are created equal.
Yeah, I think that, yeah, we can certainly do that. Those are great questions, and yeah, some basic education around how vaccines work would be great.
I would love to see along with that, maybe somewhere on the website, information about different vaccines. And in my mind, I don't want to endorse or not endorse any vaccine. Like, to me, that's between a patient and the physician. I just don't want anything to be forced. I don't want any mandates, but having a location where people could go and see maybe both sides of, just to use the COVID vaccine, here are the positives, here's some, negatives of the COVID vaccine, and have a balanced resource for the public to look at. Because we could do a presentation here, but I don't rightly know how many people really go back and watch these meetings. So as enthralling as they are. So maybe just some sort of resource for the public to have a balanced view of the vaccines. And I don't know. I don't quite know what that would look like. I'm just
Sure.
sort of thinking off the top
Yeah.
of my head. But anyway, I think that would be a good resource.
Yeah. I mean, this was part of it. I wanted to kind of brainstorm a little bit, like what can we do? What can we do better to, educate people? Absolutely.
As I'm listening to this conversation, I have had several thoughts run through my mind, and particularly when Chairman read the RCW with regards to what our statutory responsibility is. I think one of the things that would help us is to clearly define to what extent we want to actually take action as a board with regards to public health. Because the fluoridation, the vaccine, to me, to Chairman Dahl's comment about, do we want the government, doing this kind of stuff, and to what level of involvement should we have? I think conversations are good to have. But also I think we need to identify how far are we willing to take something? What action are we actually willing to take beyond just having conversation for educational purposes? Because the fluoridation of water, the vaccine, you could go down the list, the food service, to what level are we wanting to get involved in, and to what level are we comfortable with having the government dabble its tentacles into everything? And I personally, as far as the fluoridation goes, my initial reaction is, if I want fluoride in my water, then let me put it in it. If I want to take a vaccine, then let me talk to my doctor and let me do it. So to me, the education part of it is educating people on what their actual individual rights are, and to what limitations are we going to put on this board's capability to to do things, to mandate things on people's lives. That kind of, there's a little bit of it that gives me a little bit of anxiety to stop and think, you know, this board may say, we're going to limit it to this, but what about the boards in 10 to 15 years? What individual freedoms are going to be eroded because we decided today that, you know, it's okay for us to put fluoride in people's water, whatever the case might be. So I think clearly identifying the extent that we're willing to take action on people's lives and implicate people's choices is important in my personal opinion.
Rick, anybody? You just look like you were gonna say something. No?
No, I think it's, anybody that's listened to me know it's pretty clear that government needs to stay the hell out of our decisions.
Yeah, I don't think that any person's personal
I've
health
never been shy
choices.
about that. I've never backed away from that.
Yeah, and I agree with that, that the personal choices for a citizen's health should be between their doctor and themselves. But in this case, we're talking about something that's maybe, well, I'm going back to a different subject. So, yeah, government should be limited as much as possible. But when we see a problem, I think we need to look into it at the same time.
But I have no issue with if the board wants to come up kind of a direction in how involved they should be. I mean, they could have a different opinion than Rick Dahl has, but he can, doesn't mean I don't share my opinion, right?
Oh, yeah.
I mean, that's,
I'm all in favor of education, but I'm not necessarily in favor of action by this board. Well, of course, it's going to depend on certain things, but for the most part, I would agree with Commissioner Dahl that to the best of our ability, we need to keep government's nose out of the decision-making process.
Yeah, I agree with that too. Yes, please.
I think one of the reasons we're having these discussions at the local level is because at the national level, there is no longer any, what I want to say, credibility because of all the financial interest, all the political interest, and whatever self-interest is driving the decisions. To me, it's going to be interesting to see the impact that RFK Jr. is going to have on straightening out the whole national dialogue. So we don't need to put you on the spot. I do appreciate you not wearing a white coat to these meetings, by the way. But we really don't need to be making these decisions locally.
well, let
If
him at
we
least
could
wear
go-
a stethoscope.
Yeah, yeah.
I
If
still
we
have one of
could
those.
go
I can
to
bring
the
it.
CDC and have trust that information was truly science-based and not based on some political agenda, some financial interest, or all of the other garbage that we are now discovering at the national level. So, yeah, but yeah, we should be making our own personal medical decisions. And we really have to hand it to the last Board of County Commissioners that stood up for this county and said, the county employees are not going to be wearing masks, and we're not going to force you to take a vaccine.
As for RFK's impact, yeah, it's going to be interesting to see. I will say that the CDC just took off, I don't know if it was today or last week, but within the last few days, CDC has removed COVID from the childhood schedule. So they removed that, must have been for some reason.
That was one of the at-risk groups that they identified that should not be getting the vaccine because there's too much unknown.
So, anything further on that? Well, thank you, Doctor, for that. And those, we'll come back to that later on. Last thing is just real quick, just the reality party update. We talked about, we passed some funding for the reality party project. Right now, it's just kind of waiting, still talking to some people who, and schools that'll be interested. And so it's sitting there in limbo, but not forgotten. I'll open it up to any other board comments or any other public comments at this point. No? Okay, well, I think it was a pretty good meeting when we're fairly not too bad on time. So we'll adjourn this meeting 11:26. Thank you all for coming.